The government shutdown is now over, but the healthcare debate at the center of the stalemate is not. And it could impact Georgia insurance subscribers.
Yeah, it could be really difficult. Zach Merchant, the co-anchor of the Georgia Vote, joins us now. And Zach, you sat down with the state insurance commissioner. What did he have to say about this?
Well, first off, he said it has been a busy, roughly 43 days now. The insurance, at the state level, the federal level, it has all been this nexus that he has been right at the center of, because part of John King's job is to oversee the Georgia Access Program, which is our state's version of the Federal Affordable Care Act exchange. Insurance policies purchased on that exchange, they're impacted by federal enhanced subsidies that are currently set to expire at the end of the year. What to do about them became the central sticking point of this record-breaking government shutdown, and lawmakers still have not addressed it. They kicked the decision down the road to a Senate vote, tentatively scheduled now for December. So if the subsidies are not renewed, many subscribers could see their premiums increase. KFF, a nonprofit newsroom, reported back in September that an average ACA customer could see their premiums double if those enhanced subsidies are not extended. Today, talking to Commissioner King, he's a Republican, and he disputed that estimate for Georgians, but he also acknowledged prices would likely rise.
KFF sometimes, they look at some of the factors, but I don't think they have as good view of the marketplace as we do.
What do you think the impact would be in Georgia if these subsidies are not extended for the average ratepayer?
It is an average, depending on your choice of insurance utilization. It's going to be about 23%.
An increase?
Yes.
That's substantial.
That's substantial. I'm completely worried about, because what we're worried is that young, healthy people will decide to walk away from the marketplace and just go use emergency rooms, which we all end up paying the most expensive, most inefficient way of getting health care delivered.
And here is another wrinkle on top of all of this. We're in the middle of open enrollment in Georgia right now. John King says last year about 1.5 million Georgians had a health insurance policy bought on the Georgia Access Exchange. He's urging people who are looking to renew their policy, take their time, look closely at the options, especially this year when there are a lot of things that are still a little bit in flux and when policies may have changed, sometimes significantly when we're talking about prices compared to last year.
Yeah, a lot to watch out for and a lot to be mindful of as you're making these decisions. Zach, thank you so much. We know you're going to have a whole lot more coming up this weekend on the Georgia Vote, both on air and on 11 Alive Plus.